All right, this is skill 13.20, assisting with chest tube insertion. So you're not actually going to be doing anything with the chest tube, putting it in or anything, but you are going to be assisting, so I'm just going to go through everything, okay? This is going to be a stop-go kind of video. I'm going to stop it, I'm going to do some stuff, I'm going to come back on, and things are going to be a little different, okay? All right, so the first thing you're going to do is you're going to check the physician's order and verify that there's a signed informed consent. Without the signed informed consent, this is not going to happen. Okay, so there has to be a signed informed consent, signed by the doctor and the patient and witnessed by somebody. It could be you, but it still has to be done, okay? And that's going to be in the client's record when possible. You're going to perform WIPSA. You're going to pre-medicate the client for pain as ordered. You're going to monitor the client to ensure respiratory status had not worsened from the analgesics. So after you give the pain medicine, you're going to make sure that you know, their respirations are still good, okay? You're going to unwrap a closed drainage system. So what I'm going to do is I'm going to show you what the wrapping looks like, okay? And then I'm going to stop the video and show you what it looks like after I have filled the water seal chamber, because I don't want to mess up the one kit that we have that is closed, okay? So let me show you what the kit looks like. Hold on. Okay, so this is what the package looks like. It's kind of a big package, right? Okay. So what you do is just open up one end of it. You can pull open this white here too. When you get into the facility, this does open it as well, okay? And then it's wrapped in the blue, okay? Maybe double wrapped. Okay, this is what it looks like in the box, okay? There's a handle. And then at the bottom, if you turn, there's a stand for it, so that when you put it down, it's more stable, okay? All right, so let me go over the different parts of this for you. Okay, so we've got A, which is your suction control regulator, okay? And this is always set at 20, okay? You've got the water seal chamber, which is B, right here, okay? You've got C, which is your air leak monitor, right here. D is your collection chamber. This is where you're going to be measuring how much fluid is coming out of your patient, okay? It's going to be right in here. E is your suction monitor bellows, right here, okay? F is your positive pressure release valve. And so that's up here. It's really hard to see. Okay, it's right here. Right here. Oops, right there. Okay? So that is your positive pressure release valve. G is your manual high negativity vent. And that's really hard to see. And that's right here. Okay? Right here. Got it? See it? Right here. Okay. And then H is your inline connector. So that's going to be right here. Let's see if I can get this off. I don't think so. Right here. This is your inline connector right here. Can you see it? All right. And then I is your patient tube. That's what this says right here. Okay. This is your patient tube. And then J is the suction port, and that's right here. Okay? All right. So, what happens is you get your kit out, and it looks just like this. And then in the back, you'll notice there's a thing of the sterile water. If you take that out, okay, and you snap this off, then you then can pour it, right? Where are you going to pour it? You're going to pour it into the suction right here, okay? So when you pour it in, it goes through and it collects in here. And when it collects in here, it makes a blue color. Okay, and I'll show you that on the one that I've already got all set up, okay? All right, so I'm gonna stop it and get this all ready, and then I'll come back with the one that's already set up. Okay, so here is a chamber all set up, okay? So we've unwrapped it, and we filled the water seal chamber with sterile water to the water liner as specified. So there is a 2 centimeter water line here. You want that liquid to go to there. Now you may have to at some point add more sterile water in there as the days go on, because you know, with evaporation that does happen, okay? So you may have to add some water in there, okay? All right. There are also hidden in the handles, I mean, it's hidden like this, okay? Okay, in the handles are some handles like this, some hangers. And that's so that you can hang this on the side of the patient's bed, okay? All right, so those are there, and they're right in the handle, right in here, okay? All right, and then what you do is you take the patient tubing and you connect it to, you take the patient tubing and connect it to the tubing up here on the top of the collection chamber. Okay, so that's all ready to go. All right, so that's all set. Good. Now we're going to position the client as directed by the primary care provider. What you want them to do is you want to have them either placed flat or in a semi-Fowler position, okay? Oh, you can't see them. I should turn it so you can see the patient. Okay, hold on. We're getting there. Okay, there we go. So you want to position the client as directed by the primary care provider. You want them to be either placed flat or in a semi-Fowler position, which he's in, okay? You want to turn the client laterally. You know, laterally means on their side, right? So I've put a pillow in here to try to get that up, okay? So that the receiving tube was facing downward. So he's going to go down like this, okay? All right, so what's nice about a mannequin is we can actually puncture a hole in there and show you where the chest tube would go and not have any issues with it, okay? So that's where it's going to go. Got it? Okay, so then what's going to happen is the physician is going to come in and he's going to want to get gowned, okay? And you're going to assist with him getting into his sterile gown. But then he's also going to want the chest tube kit, okay? And what you're going to do is you're going to get a kit, and it's going to look something like this, okay? And the only thing that you need to do with this kit, the only thing that you need to do is you need to peel off the top of this, okay? And do you see that? Whoops. You see that yellow thing right there? What's going to happen is the physician's going to come in with their sterile gloves and just take that right off of there. And they're going to put it down on the table that you've cleaned off, right? Because you want a clean table to put this on. They're going to take this and put it on your clean table, and they're going to open up their own sterile field, okay? They do this, okay? So your only responsibility is to make sure that the equipment is there and that you open it for them once they get their sterile gloves on, and they will take it from there. They'll take it right from here, okay? All right. So what's going to happen is then the physician is going to ready the field. So I've already placed the drapes like this. This would be drapes like this. Probably it'll be a disposable kind of thing that is put on, and it has a hole right here, okay? It'll be completely enclosed like this with just a hole in there, okay? And that'll be their clean zone, their sterile zone. And what they'll do first is they will swab that with either betadine or chlorhexidine wash, and they'll wash that all off to make it sterile, okay? And then they will ready the rest of their field, okay? So if you were to look in this sterile kit here, okay, you'll notice that inside, just right inside the flap, is the ChloraPrep, okay? That's so that the physician can just pull that out, right? They pull this out and they put it down on your clean table, okay? And then they take this out, because it's sterile, right? They take it out and they clean the site. And when they're done cleaning the site, they'll put this in the garbage bag that you're going to provide, okay? And then what you're going to do is they will set up the rest of the sterile field. So they will open this up and get everything else ready while that is drying, because that needs to stay on the skin for a specified amount of time to kill those microbes that are on it, okay? All right, so they've come in, they've prepped the field, okay? And they are going to be inserting it, okay? And I'm gonna talk to you about the insertion. I'm gonna pause the camera, and then I'm going to insert a chest tube. Did you see that? Insert a chest tube, and then I'm gonna turn the camera back on and show you what else we need to do. Because as nurses, our job is to assist with the chest tube insertion, not to do it, okay? All right, so the clinician comes in, they've gloved up, they've gowned up, they've got this whole thing prepped, okay? They've cleaned it, they're gonna draw up on a local anesthetic. Now the kits nowadays have local anesthetic in them. If not, they may ask you to go ahead and get some lidocaine. You'd get that out of your Pyxis, your Acudose, whatever, and you would hold the bottle and allow them to insert a needle in and draw out the antiseptic, okay? And then before anything else is done, before a needle is stuck in the patient, okay, before that's even done, you're going to do timeout. And you're literally going to say that. You're going to say timeout. And what that is, it's a pre-procedure verification. And you're going to make sure that the patient that you're about to stick a needle in and about to insert a chest tube in is the patient that you actually should be doing it on. Okay? You're also going to make sure that you've prepped the correct side. You would hate to put a chest tube in on the right side when it actually should have went in on the left, right? That would be terrible. That would be terrible. So you're going to verify the patient. You're going to verify them with two things: date of birth, right, and name. You're going to verify that it's the correct procedure, the correct site, right? So this is all within your timeout. Once that's done, and it's a paper that you fill out, every facility has a different paper, okay? Once that's done, you can continue on with your procedure, okay? What is your job at this point? Your job at this point is emotional support for that patient who's going to now have a chest tube inserted into their side. So what do you do? What do you do? You're going to get right down there, okay? It's okay, Mrs. Smith. It's okay. I know. It's going to hurt. I understand. But you're going to be feeling much better afterwards. So just emotional support, holding their other hand, okay? Now you notice we have an arm that's up underneath here, right? And so when they go and stick that lidocaine in, or they go to put that chest tube in, and what happens if this patient's arm flinches? So what are you going to do? Well, very easily you could stick your arm underneath the sterile field if your provider says that's okay, and you could hold that arm, okay? You could also be reaching up above and holding, okay, and not getting into the sterile field, okay? All right. You may actually have to do that, okay? Okay, now I'm going to pause it, and I'm going to insert the chest tube. Hold on. Okay. So as you can see, the chest tube has been put in, right? And I've gone ahead and put a dressing on just because it wouldn't stay in without it. So I'm going to show you what is going to be underneath that dressing, okay? All right. The first thing you're going to do, the first thing that's going to happen is the chest tube is going to be inserted by the physician, okay? And then they're going to take a petroleum gauze, okay? And the petroleum gauze is going to come in a container like this, okay? It'll say petroleum gauze right on it. It's just a strip of gauze, like, whoops, like this, okay? It has petroleum jelly all over it, Vaseline, okay? And what happens is you put that goes around the tube, okay? So you would literally just put this against the skin around the tube, okay? Got it out? Okay. The next thing we want to do is we want to put some sort of a gauze over that. So what we use is we use these split gauzes, okay? You've seen them before with the trachs, right? Okay, so you would take this and you'd put one down, okay? So one facing down and then one facing up, okay? Okay, like that. And then, just in case there's other leakage, you would be just taking regular gauze, okay? And you could reinforce this gauze around here just to make sure that you had, in case there was drainage that came out. And then you would tape that. I mean, tape it. You don't want to see any holes, okay? So that's the reason why you're seeing all of that tape, okay? Is you want to make sure that you have it taped up good. You don't want any holes there. You don't want any chance that germs could be getting in there, okay? So that's what you do in order to dress the site, okay? Now the other thing you need to worry about is securing the tube. Okay, so we have a chest tube there, and patient's going to bring their arm down, and it could be knocking the tube, okay? It could be dangling. Let me see if I can move this. Dangling on the side of the bed. Do you see that tube? Could that not get caught in our stethoscope, in our feet if it's on the floor, right? Right? So we have to make sure that that doesn't happen. We don't want that to get accidentally pulled out of the patient. One, it's going to hurt the patient. Two, the physician is going to be really, really mad. And three, the patient's going to have it inserted, another one inserted. So let alone it opens up them to a chance of infection. So we really want to be careful about the tubing itself, okay? So what we want to do is we want to coil that up. Oh, wait a minute. Maybe I should probably tell you. This drainage system, the closed drainage system that we opened before, the thing that's got the blue dye in it, okay, that doesn't stay up above the patient. So before we inserted the tube and before we connect it, well, I guess before we connect it to the patient, because we haven't connected it yet, before we connect it to the patient, we want to make sure that it's below the patient, okay? So that's where these hangers come from. You hang it on the bed. So as you can see, we've hung it on the bed and we have all this tubing that's now dependent on the bed, so it hangs down to the floor. So we want to be careful with that. So what we do is we just coil it up onto the bed itself, okay? Make sure there's no kinks in it. There we go. Make sure there's no kinks in it, and we would tape it into place. So we would take some tape and we'd make a tag, I should say. Okay? Take a tag, make a tag, put it on here. Okay? And then we would pin it to the bed. This would get pinned right to the bed. All right? You see that tag? I'm not putting the pin through the tubing. I'm putting it through the tape that's connected to it, okay? So you would secure that up there on the bed so that it's not hanging and it's not dependent. All right? So we got all that done, and we have this tube that we have coming out of the patient, and we need to connect it to the machine, right? Because we have this end right here that's got to get connected to the machine. And we also want to make sure that we connect the suction, the wall suction, to the box. Is there any specific numbers that you might